So this is social anxiety in university students. Social anxiety is defined as excessive fear of social situations. This is characterized by a fear of being judged by others when in these situations, and can also include avoidance of social situations. And this can be maladaptive, as social anxiety can cause significant distress or impairment in social, occupational, or other important areas of functioning, such as academic. Some risk factors, like some other mental health disorders, social anxiety can be a combination of psychological, social, and biological factors. Some examples being stressful or traumatic life events like physical or emotional abuse, like bullying, as well as family history of the disorder. So some contributing processes to social anxiety, one of them being self-focused attention. Social anxiety can be maintained by self-focused attention, and this is when one shifts their focus of attention from their surroundings onto themselves. And in doing this, socially anxious individuals may now be more aware of their own anxiety responses, as well as them now not adequately processing others' behavior or their surroundings. Another contributing process is post-event rumination. Post-event rumination occurs after a social situation has occurred, and one is stuck obsessing over the event, replaying it in their head, and thinking about all the perceived things that they did wrong, which increases their anxiety. Social anxiety typically starts in childhood or adolescence, around 13 to 16 years old, and of those diagnosed, most individuals have developed the condition before they were 20. And for prevalence rates, social anxiety in university ranges from 10 to 33%, compared to 7 to 13% when in the general population. Some key aspects of university and academic achievement are engaging with professors, classmates, small groups, etc. And so those suffering from social anxiety may be at a disadvantage, as their fear of negative evaluation and avoidance of social situations may have a negative impact on academic achievement. These individuals may find it difficult to join in classroom conversations, participate in activities or projects, as well as asking classmates or professors for help when needed. So one intervention used for social anxiety is self-compassion. Self-compassion is defined as having a non-judgmental approach to one's own pain or perceived failures. It's being open to our own suffering. Past studies have shown that self-compassion is beneficial for processes involved in social anxiety. One showed that socially anxious individuals showed lower levels of anticipatory anxiety before speech after completing a self-compassion condition compared to a control one. Another study showed how engaging in self-compassion led to less post-event processing the following day. And self-compassion also led to increased willingness to participate in future social situations. So in terms of university students, this could be beneficial if it leads to increased participation, asking for help and understanding, as well as less negative rumination about past social encounters. So how to engage in self-compassion? There's 3 components of it. There is self-kindness, common humanity, and mindfulness. Self-kindness is extending kindness to yourself and not harshly criticizing or judging yourself. Common humanity is seeing our experiences as part of something bigger, not isolating our experiences from everyone else's. And mindfulness, which is being aware of our negative thoughts or feelings in a balanced manner and not overly examining them. So some examples of how to use these could be thinking and writing down ways in which other people feel the same way you do. Like if you were anxious about something, you may feel nervous, sweaty, shaky, have an increased heart rate, etc. Talking to yourself the way you would talk to a friend going through the same situation. So if a friend was nervous, you would comfort them and let them know that it's okay. You would just do that to yourself. And thinking or writing your negative feelings, but in a balanced manner, not judging or being harsh on yourself for how you're feeling, but being kind towards oneself, but still acknowledging the feelings you have. And some resources that we have around campus is the mental health crisis line. There's also an online mental health support called Healthy Minds, which is healthymindsns.ca, and also the Nancy Dingwall Health and Counseling Center, where you can book appointments at health services at cbu.ca. Thank you.